Hello, thanks very much for inviting me, and I'm very moved by what I've heard today. I've got two hats on really, and I'll just speak briefly about one, which is that I'm a GP in Lewisham, in quite a deprived borough, and so I do see the effects of the cuts, low wages, benefit cuts, etc., poor housing on my patients. And we know that these sort of things lead to anxiety, to stress, and these have an effect on people's health. Because good health, as you all know, is a complex mixture of physical, social, emotional. So I see the effects on some of my patients, and of course on their children. Because if parents are stressed, if parents are struggling, it has an effect on the children. Women are the main carers in society. Women struggle to care for young children and family members who are sick, disabled and elderly, and of course they need a living wage. All carers need a living wage. I think the care allowance is extremely low, and carers don't get the respite and the support that they need to do that work. And I know how important the role of carers is in promoting health and supporting people in the community. I'm a member of the BMA Council, but I'm speaking in a personal capacity. And I put through the successful motion at the last BMA conference to oppose and to call for the rejection of the work capacity assessment, the ATOS work capacity assessment, as being totally inhumane, and that it should be abolished and it should be replaced, if necessary, by a humane system of helping and supporting people to get back to work. I think GPs, doctors do have a role to play, as do other professionals, in supporting their patients or their clients or their pupils or whoever that they encounter, and to speak out and to speak up for those people. So that's partly what I'm doing. But I've also got my other hat, which I'm also chair of the Save Lewisham Hospital campaign. And this is another aspect of well, it's the aspect of caring, which is the welfare state. It's what we have come to expect, good standards of care, good standards of health care. And what we're seeing is that is under threat everywhere. It's under threat through cuts, massive cuts. £20 billion worth of cuts to the NHS are happening over the next 4 years. And after that, further 20 billion cuts. It's going to be unrecognisable by 2019. In addition, the government took £2 billion out of the health budget last year, just took it back to the Treasury and didn't use it to reinvest in developing healthcare, which is what they said they were going to do with it. There's a whole programme of hospital closure around the country. Probably up to about 20 hospitals in London are under threat. Certainly currently there are hospitals all across London which are threatened with closure. Lewisham Hospital, our local hospital, is threatened with closure. They're going to close the A&E and the maternity, and the A&E is the front door to the hospital. When that goes, all the acute beds go, and they're going to sell off 60% of our site to, who knows, to private developers or what, and just leave a small remnant. And they're going to destroy our really successful and popular maternity unit there, which has 4,000 births a year, with women coming from outside Lewisham who want to use the birth centre. They're going to replace it with a tiny service which will only deal with 10% of those women who want to give birth. The part of the reason that Lewisham is under threat is because of a thing called PFI, Private Finance Initiative. I don't know if you know about it, but it's a terrible way that was used to fund rebuilding hospitals, and it's just like paying for a hospital using a payday loan or something like that. It's an extortionate rate of interest, something like 70%. And neighbouring hospitals to Lewisham, which is Queen Elizabeth Hospital in Woolwich and the Prince's Royal in Bromley, were rebuilt in the early 2002 or 2003, I think. The combined cost of rebuilding those hospitals was just over £200 million. They've already paid back, the hospitals are forced to pay this money back out of their revenue for running their services, and they have to give that first slice of any income, and then after that, whatever's left is used for services. The hospitals have paid back 600 million already. They still owe 2 billion. Can you believe that? It's unaffordable. And instead of actually recognising that this is the problem, this government, it wasn't this government that did the PFI deals, it was the last government, these particular PFI deals, but this government had then turned to Lewisham Hospital, which is in a different area, and said, well, here's a solvent, busy, popular, successful, high-quality hospital. Let's close it, because then we can divert patients from there to the troubled hospitals, Queen Elizabeth and Princess Royal, because money follows the patients. So that will bring income in to shore up these indebted hospitals. That is the kind of thing that this government is prepared to do. And people in Lewisham are fighting back tremendously. We have had the most amazing campaign across the whole of society. And we had a massive demonstration at the end of January of 25,000 people. And we're not stopping that. We're still campaigning. We're taking Jeremy Hunt to court, challenging him for the judicial review. And we're very excited about that, and we think we've got a very good chance of winning. And you can find out all about the detail on our website, which is www.saveLewishamHospital.com. We've also joined up with other campaigns in London and across the country. We've taken up other issues that are related to cuts and closures, like the privatisation of NHS, which I know you all know about. And actually, just as an aside, I do think the privatisation of the carers services is terrible. The carers get paid very little, the 0 hours contracts, sometimes they don't get paid in between seeing patients, and it has undermined the relationship of trust between the patient and the carer. And that is something that epitomises the whole impact of privatisation. It destroys caring relationships, it destroys professional relationships, and it replaces them all with financial relationships. And the bottom line is what matters, and how much profit you can make. So our campaign is taking up all these issues, and we're joining up with other campaigns in London to have a big demonstration on Saturday the 18th of May. We'd really love you all to come and join that demonstration. It's starting in the Jubilee Gardens in Waterloo at 12 noon. So please come and join us. Thank you very much. Sorry. Saturday the 18th of May. Yeah, 12 o'clock. Thank you.